Welcome to the Prescription Addiction Radio Show, Breaking the Silence, on Talk Radio 860 WGUL, with your host, Larry G. The Prescription Addiction Radio Show is dedicated to families and family members who have been affected by the misuse of prescription drugs. Now, your host and family pharmacist, Larry G.
All right, we have Kevin Dixon on line 4. Kevin is from KD Consulting, and I'm proud to tell you that just this week, prescriptionaddictionradio.com, our website, we now have Kevin, KD Consulting, linked up with our radio show. Kevin, how are you tonight?
Good, Larry. How are you this evening?
I'm doing great. Hey, thanks for calling in. I'll tell you, I got to tell you, that last call that we got was fantastic. I waited a long time to get a call, a rational caller like Jack, because I think he helps us put where we have to go in the proper perspective.
Absolutely. Larry, as I've heard the show evolve, and proud to be a part of it, and talking about solution, and the listeners that are on prescription drugs and or loved ones that are hearing the show, and that their loved ones are in denial and taking it as prescribed. And as Jack brought up a good point. Well, as prescribed. I mean, that in my business, I did an intervention this past weekend, Larry, and that was her mantra, if you will. She was in denial, the number one symptom of addiction, and she had a pain management doctor. And of course, the red flag, what you would think, would be that she had a child that was addicted, born addicted, and then she had another child, and this is all because of as prescribed and a pain management issue. But anyways, the second child was born with Down syndrome, and you would think those are red flags in doctors and family, but unfortunately it wasn't, and we were blessed to come in and help the family and really bring a bottom and doing the intervention, Larry. And again, in the kind of business that I do, in intervention work and being in denial, and as prescribed by my doctor. Well, that word right there is killing people with OxyContin and some of the other drugs that are out there, Vicodin, hydrocodone, that you're so eloquently putting out there. The message that as prescribed is really that word is being. I don't know.
Used as a justifier?
Yeah,
it justifies their drug use.
And I want to clarify, the reason I was so happy that Jack called in. I was ready to jump down his throat.
Yeah,
but he's one of the few rational people. He clearly, from the way he described it, was taking the product the way it probably should be taken. Hey, he wasn't overdoing it, and of course, the as prescribed in your world and my world, the as prescribed is 4 a day,
yes,
6 a day, 8 a day.
And what I heard with him as well is that he had some underlying issues that he was getting professional help for. Acute depression, and it sounded like he was getting treatment and therapy for that. So that was wonderful, and to hear that, but to have somebody, have the courage to say, there are those that are out there that, with good doctors and bad doctors, and that word as prescribed, are truly trying to take responsibility for it. But
I'm intrigued by these. I am intrigued by these drugs, the oxycodones, the hydrocodones, oxycodones. I'm just intrigued. Kevin, I'm convinced there are people who just take 2 a day, and they can't get through their day with just 2 without taking those 2. These opiates are a mystery.
But it's Larry, it's also things like metabolism and what your body is actually breaking it down and using.
Well, and again, in doing 2 interventions this since last speaking with you, Larry, and this particular 27-year-old female, and she's in denial about and it is when we're dealing with someone in denial and doing an intervention with her, and this was a situation where she had an injury and got hooked on Vicodin, hydrocodone, and then the OxyContin, and shuffling between the methadone, and then having a child that was addicted to it. And, so the family was waiting waiting for, those responsible doctors to jump in. A little baby is now the byproduct of, an irresponsible doctor and medications that are prescribed by somebody that obviously had addiction issues. But the reality is that the family, thank God, had said, what do we do, and found someone, and like myself, and the more education through radio shows like yours, and getting the word about interventions and treatment and therapy, we're never going to win that war on drugs, the private sector with pharmaceutical companies and the doctors. But what we will win back is one listener at a time, one family at a time. And again, I see it every day as you see it on the other side of what you do professionally, and seeing it in mainstream America and what I do when they've hit these bottoms.
Right, and just we're down to about our last minute, Kevin, and I certainly don't feel comfortable cutting this off. But just in summary, KD Consultants. This is Kevin Dixon, and in Interventionist. Is that if they watch the show Intervention, can I say that they're essentially watching Kevin Dixon?
Well, yes, and what I do. If they'd like to, they can access my website, which is, www.kdconsulting.org or lifelineintervention.com, and they can see some of those media pieces that I've done. But, yes, the show Intervention has done a great job to really get the awareness out there about, raising the bottom through a professionally orchestrated intervention.
Folks, one more time, and I'm going to make it even easier. PrescriptionAddictionRadio.com, right on the upper right-hand corner. KD Consultants. This is Kevin Dixon. If you have a family member who how should I put this, Kevin? A family member that needs help?
Yeah, well, who's in denial and needs help but is unwilling to, and the family, knows that they do, then they need to reach out to a professional. So it's a family member that's in denial and needs help.
Folks, Kevin Dixon, KD Consulting. Kevin, have a great week. Thanks for being with us tonight.
You too, Larry. Keep up the great work.